So இப்போ let us discuss about the opportunities and like just one by one. So நீங்க என்ன பண்ணீங்க, like what are all the after PG நீங்க என்னெல்லாம் பண்ணீங்க, and what are all the opportunities and future aspects என்னெல்லாம் இருக்கு, like what is the like is AI going to really disrupt the thing, or how we are embracing as a, like I think this is the only specialty which is embracing AI more than any other specialty. So we just want to understand how all these things happen, and இவங்க உள்ள வரும்போது எப்படி இருக்கும். And also we see lot of memes saying like radiologists earn more. So அதை பத்தியும் கொஞ்சம் maybe if you're okay you can discuss about it. So that will be motivation for people to go through it. So I'll start with Ebinesh sir again.
So yeah, touching about AI with AI in radiology, one thing I would say is, why do we call it artificial intelligence? I would call it augmented intelligence. ஸோ அது வந்து என்ன பண்ணணும்னா, இட் இஸ் கோயிங் டு ஆகுமெண்ட் மை ஒர்க். ஸோ இப்போ ஐ மீன் இந்தியாவில் நான் அவ்வளோவா ஏஐ யூஸ் பண்ணல, பட் ஆஃப்டர் கமிங் டு யூகே வி பீன் யூஸிங் ஏஐ ரெகுலர்லி. எந்தெந்த இதில் யூஸ் பண்ணிட்டு இருக்கோம்னா, வி யூஸ் ஏஐ டு ஃபர்ஸ்ட் இஸ் வி யூஸ் பேசிக்லி ரொம்ப காமனாக 3 ஏஐஸ் யூஸ் பண்ணுறோங்க. ஒன் இஸ் ஃபர்ஸ்ட் இஸ் யூஸ் இட் ஃபார் வி யூஸ் இட் ஃபார் போன் ஏஜ் எஸ்டிமேஷன். இப்போ நான் ஒர்க் பண்ணுறது ஒரு சில்ட்ரன்ஸ் ஹாஸ்பிட்டல், ஆல்ரெடி சில்ட்ரன்ஸ் ஹாஸ்பிட்டல். ஸோ வி யூஸ் இட் ஃபார் போன் ஏஜ் எஸ்டிமேஷன். வி ஹேவ் a tool called bone expert. So it gives a bone age itself. இல்லைன்னா நாங்கள் இந்தியாவில் இருக்கும்போதெல்லாம் என்ன பண்ணுவோம்னா, வில் செக், ஓகே ஏஜா, ஓகே இந்த ஓகே கேபிட்டலில் மாசிஃபைஸ் திஸ், இது அதுக்கு வி ஹாவ் நிமோனிக் கால்டு கிரைட்டோ அப்படின்லாம் வச்சு, ஓ இது இந்த இயர், இது 11 to 9 to 11 years, இது இந்த இயர், இது இந்த இயர் அப்படின்னு. See, so that is so அந்த மாதிரி பார்த்துட்டோம்னா, இல்லைன்னா we'll have an atlas where we'll have to refer to, okay இந்த ஏஜ்ல எக்ஸ்ரே எப்படி இருக்கு, இந்த ஏஜ்ல எக்ஸ்ரே எப்படி இருக்கும் அப்படின்னு புரட்டி பார்த்து ரிப்போர்ட். ஸோ இது வந்து ஸோ அந்த மாதிரி அப்படி நான் ரிப்போர்ட் பண்ணேன்னா, மேபி ஒரு எக்ஸ்ரே நான் ரிப்போர்ட் பண்றதுக்கு ஐ வுட் மேபி டேக் 15-20 minutes. இப்போ இந்த போன் எக்ஸ்பர்ட் ஏஐன்னு வந்துச்சுன்னா, இட் கிவ்ஸ் மீ அன் ஏஜ். ஸோ 2 டிஃப்ரெண்ட் மெத்தட்ஸ்ல, ஓகே இந்த மெத்தட் படி எஸ்டிமேட் பண்ணா இந்த ஏஜ், இந்த மெத்தட் படி எஸ்டிமேட் பண்ணா இந்த ஏஜ், மீன் ஏஜ் வந்து இது, குரோனாலஜிக்கல் ஏஜ் வந்து இது. ஸோ அது அப்படின்னு அது கிவ்ஸ் மீ a conclusion. So what I'm saying is, I get it within a fraction of seconds. So if I'm taking an X-ray to, if I'm using it to, I mean, if it is taking me 15 minutes to do an X-ray, here I'm doing it in 10 minutes, I mean 10 seconds or few seconds, why will I not do that? So what I feel is, it will help me do my work better. So I would call it augmented intelligence. Why don't make use of it? And the other place where we use it, இப்போ நாங்கள் ரிப்போர்ட்டிங் வரோம்னா நிறைய கேசஸ் நடக்குது, நிறைய சிடிஎம்ஆரை அக்வயர் பண்ணுவாங்க. சம் பேஷண்ட் மைட் ஹாவ் சம்திங் எமர்ஜென்சி. ஸோ வந்து இப்போ எமர்ஜென்சியை வந்து ஸோ வி யூஸ் an AI where it flags an emergency saying that, okay இது வந்து நீங்கள் உடனே ரிப்போர்ட் பண்ணணும் அப்படின்னு. இன்னொரு ஸோ it helps us in triaging cases. And one more place where we use is, ஏதாவது கிரிட்டிக்கல் ஃபைண்டிங் இருந்துச்சுன்னா ரெஃபரிங் ஃபிசிஷியனுக்கு டைரக்டா ஒரு நோட்டிஃபிகேஷன் போயிடும். யாரு அனுப்புறாங்களோ அவங்களுக்கு டைரக்டா ஒரு நோட்டிஃபிகேஷன் போயிடும், இப்படி உங்க பேஷண்ட்டுக்கு ஒரு கிரிட்டிக்கல் ஃபைண்டிங் இருக்கு அப்படின்னு. ஸோ that is all we have been using. ஸோ இப்போ எங்க ஒரு ரேடியாலஜிஸ்டோட ரோல் இதில் வரும் அப்படின்னா, இப்போ இட் மைட் சே ஃபார் எக்ஸாம்பிள் ஒரு லங் நாடியூல் வந்து கேன்சரா இல்லை நான் கேன்சரஸ் நாடியூலான்னு கேரக்டரைஸ் பண்ணணும்னு வச்சுக்கோங்க. இந்த ஏஐ மைட் ஹெல்ப் மீ டு பிக் அப் அ நாடியூல். எனக்கு ரொம்ப சின்ன நாடியூல்லாம் நம்மளுக்கு when we are reporting நமக்கு தெரியும், ரொம்ப சின்ன நாடியூல்லாம் கண்டுபிடிக்கிறதுக்கே ரொம்ப கஷ்டம். So it might pick up a nodule and say that there is a nodule, but it might also give me a prediction that this is cancer and non-cancer, this much percentage that this could be cancer. But it is eventually my judgment to assess whether it is right. So I think that why do we not make it a friend? Why do we think that it is a foe? So I would call it augmented intelligence because it augments my work. So if AI இல்லாம நான் ஒரு நாளைக்கு 20 cases report பண்றேன்னா, AI யோட என்னால 40-50 cases report பண்ண முடியும். So it makes me do my work faster and more efficiently and better and safer. And that is my take on AI. And இப்போ அதுக்கப்புறம் ஓகே பிஜிக்கு அப்புறம் என்னன்னு பாத்தீங்கன்னா, after okay, the moment I finished PG, I realized that I know nothing about radiology. Okay, the moment I finished PG, you feel very humbled that because radiology is so vast. See, you are under supervised learning or something. So when you are independently doing a scan, reporting and everything, அதெல்லாம் பண்ணும்போது you feel that there is a lot more to learn. And அது எந்த மாதிரி ரொம்ப ஹம்பிளிங் எக்ஸ்பீரியன்ஸா இருக்கும் அப்படின்னா, ஐயோ இதெல்லாம் நம்மளால எல்லாமே முடியாது. இப்போ எனக்கு வந்து ஆரம்பத்துல டாக்டர் லாவண்யா சொன்னாங்க அவங்களுக்கு ஆப்ஸ் ஸ்கேன் எல்லாம் ரொம்ப பிடிச்சிருச்சுன்னு. எனக்கு நான் ப்ராக்டிஸ் பண்ண ஆரம்பிச்சோன்னா எனக்கு புரிஞ்சிச்சு, ஐ எம் நாட் ஆப்ஸ் வந்து எனக்கு வேண்டவே வேண்டாம் அப்படின்ற மாதிரி எனக்கு தோணிச்சு. ஸோ அதுக்கப்புறம் என்னாச்சுன்னா, ஸோ வாட் ஐ வுட் அட்வைஸ் இஸ், ஃபர்ஸ்ட் ஃபார் அட்லீஸ்ட் 1 year பிஜி முடிச்சுட்டு ட்ரை எக்ஸ்ப்ளோரிங் ட்ரை யுவர் ஹேண்ட்ஸ் இன் எவ்ரிதிங் வித் ஜென்ரல் ரேடியாலஜி. ஒரு ஜென்ரல் ரேடியாலஜி மேபி டூ இட் அஸ் an SRship or go to a good corporate hospital or go to a good teaching hospital where you can learn everything, where you can strengthen your foundation in general radiology. அது முடிச்சிட்டு then you will understand that okay என்னோட strength இதுதான் எனக்கு this is what is. So what I would say is choose a field that will be it NEET, be it a broad specialty like radiology, medicine or surgery, or be it choosing a specialty within radiology. What I would say is 10 years from now you should not push yourself to work. You should love it so much that you should find it very interesting. இப்போ எனக்கு இங்கே கேசஸ் எல்லாம் வந்துச்சுன்னா திடீர்னு எனக்கு பீடியாட்ரிக் ரேடியாலஜி எனக்கு ரொம்ப பிடிச்சதுக்கு காரணம் என்னன்னா பீடியாட்ரிக் ரேடியாலஜி there are so many things that are totally different from adults. இப்போ ஒரு லிட்டிக் லீஷன் போன்ல ஒரு லிட்டிக் லீஷன் இருந்துச்சுன்னா அடல்ட்ல we'll think of metastasis, pediatricல we'll think of Langerhans histiocytosis. So on the Mari, totally they were different. So it is everything was totally interesting. So every new case I see, even if it is just ileocecal junction thickening on it is totally new. It is different. Everything is different. So it is like every day I found it very interesting. So I don't have to push myself. It is like okay, okay, I'm on MRI today. MRI in the case. So I'm pushed to it all by myself. I don't have to push myself at all. So it is like I find it very attractive. So choose a subject like that. So spend 1 year to explore everything. 1 year or 2 years or 3 years. It is up to you. It is at your own pace. It might not what formula work for me, might not work for you. So அந்த மாதிரி யாருக்குனாலும் ஒரு முடிச்சுட்டு ஒரு 1 year அந்த 1 year வந்து ரொம்ப இதாக தான் இருக்கும், கொஞ்சம் கஷ்டமா தான் இருக்கும். அண்ட் they say that okay radiologists are getting paid more அப்படின்னு, but that is also I think it is not, it is partly true, I understand, but it is not entirely true. So and the initially few years when I came to a few corporate hospitals in the southern I mean Delhi முடிச்சிட்டு வரும்போது டெல்லியில முடிக்கும் போது எனக்கு எங்க மந்த்லி ஸ்டைபண்ட் வந்து it was around 1.27. இது தமிழ்நாட்டுல வந்து கொஞ்சம் கார்பரேட் ஹாஸ்பிட்டல்ஸ்ல கேட்கும்போது they offered 90,000. so or maybe I think few went up to 1 lakh per month. I'm talking about 2023, not very far, 2 years back. So on the time so it is really not true that radiologists get paid more initially. Maybe with experience you can get paid more. And the initial years ரொம்ப கொஞ்சம் கஷ்டமா தான் இருக்கும். இப்போ கார்பரேட் ஹாஸ்பிட்டல்ஸ் இன்னொன்று என்னன்னா, all corporate hospitals want a 24/7 coverage from radiology. Most corporate hospitals, unless they have PGs, unless even கொஞ்சம் காலேஜஸ்ல PGs இருந்தாலுமே they want consultants to work. They want post PG SR or able someone to work 24/7. So அதனால they all work on shift basis. இப்போ நான் முடிச்சுட்டு ஒர்க் பண்ண ஹாஸ்பிட்டல் வந்து it was a quaternary care center where we were working on shift basis. We had one shift working from 8 to 4, one shift working from 10 to 6, one shift working from 12 to 8, and one shift from 8 to 8, night 8 to morning 8. So 4 shifts, one shift per week. So we'll have 4 weeks per month. அந்த மாதிரி ஒரு shift cover பண்ணிட்டு இருந்தோம். So அதனால you won't really have a routine also initially to begin with. So you will have to endure all this. So for first 1 year or even up to 3 years, you will have to endure another period of hardship. Where you prune yourself, where you tune yourself. That is going to be hard. On the time what I would say is okay, pick up whatever your special interest is. 1 year or 2 years, pick up what your special interest is, then work towards it. So that is what my advice would be. And it is like and it will be like you will do your so அந்த இன்க்ளினேஷன் வந்து உங்களுக்கு ஃபர்ஸ்ட்ல இருந்தே இருந்திருக்கலாம், பிஜி ஸ்டார்ட் பண்ணதுல இருந்தே இருந்திருக்கலாம். ஓகே இப்போ பிரெஸ்ட் இஸ் மை ஏரியா ஆஃப் இன்ட்ரெஸ்ட், நியூரோ லாவண்யா சொன்னாங்க நியூரோ உங்களுக்கு ரொம்ப நாளா இன்ட்ரெஸ்ட் இருந்துச்சு, நியூரோ இட் குட் பி ஃப்ரம் யுவர் old, I mean ரொம்ப நாளாவே இருந்திருக்கலாம் அந்த இன்ட்ரெஸ்ட், பட் ஸ்டில் யூ வில் நீட் சம் strengthen your base in general radiology and then explore what your interest is. And we are what and one more is அவங்க எல்லாம் இப்பெல்லாம் முடிச்சுட்டு வரும்போது we are evolving into a phase where subspecialization is important. We are evolving. We have already evolved there, I feel. Even many corporate hospitals, many hospitals in Tamil Nadu are looking for subspecialty reporting. நான் வந்து வெள்ளூர்ல work பண்ணிட்டு இருப்போம். A patient came and asked me, are you a neuroradiologist to report multiple sclerosis? ஒரு patient ஒரு attendant என்கிட்ட வந்து கேட்டாங்க. So yeah, that is how it is. And இது எதுக்குன்னா நம்ம பேஷண்ட் அவுட்கம்ஸ் நம்ம பார்க்கும்போது நம்ம பேஷண்ட் அவுட்கம்ஸ் ப்ரொவைட் பண்ணோம்னா we'll need people who are very knowledgeable about that particular field. Only then we'll be improving more outcomes. Yeah, அதனால I think subspecialization is something that is very important in the coming future. So you will have to evolve into that. You will have to be ready for that. So what I would say is PG முடிச்சிட்டு டைரக்டா ஜம்ப் பண்ணிடலாம்னு இருக்கு, இல்லன்னு இல்ல. People do get into private practice centersல they work, they do make a lot of money. But if you are goal oriented, if you are outcome oriented, if you are ambitious, then I would say that even after almost 3 years of your PG, you will still be in a middle grade phase where you will be learning. கத்துக்கிட்டே தான் இருப்பீங்க, உங்க ஸ்கில் பில்ட் பண்ணிக்கிட்டே தான் இருப்பீங்க. அப்புறம் அந்த 3 years அப்புறம் வேணா you will be at a stable phase. உங்களுக்கு அந்த earning phase ஆரம்பிக்கும். So at least for 3 years after your PG, you will still be learning, or you will still be building on your skills and knowledge, be it in general radiology, or you have ramified from general radiology into one specialty. And 3 years at least கொஞ்சம் இதா தான் இருக்கும். 3 years வந்து கொஞ்சம் it is like that. See, when we chose medicine only, we have got into the fate of lifelong learning, right? So அந்த 3 years வந்து இன்னொரு 3 years கொஞ்சம் கஷ்டப்பட்டு கொஞ்சம் ரொம்ப ஸ்டேபிளா இருக்காது. But there are people who do get into all this and they make a lot of money. You can make a lot of money, and there are one thing is tier 2 cities la irukra hospitals and all, they really pay a lot. I think even MD mudichone there are hospitals that pay 3.5 lakhs, even 5 lakhs. I know a hospital in a second tier 2 city in Tamil Nadu that pays 5 lakhs per month. Yeah, so there are hospitals like that. But நம்மளுக்கு லேர்னிங் அப்படின்னு பார்த்தோம்னா, எனக்கு நிறைய எக்ஸ்பீரியன்ஸ் வேணும், நான் இன்னும் நிறைய கத்துக்கணும் அப்படின்னு பார்த்தா நம்ம இன்னொரு 3 years sacrifice பண்ற மாதிரி.
And one more follow up question I want to ask you is like, நீங்க ஆல்ரெடி இதுக்கு ஆன்சர் பண்ணிட்டீங்க. லைக் தமிழ்நாட்டிலையும் there are in many corporate hospitals is asking for ஒரு ரொம்ப டீடைல்டு சப்ஸ்பெஷாலிட்டி பத்தி கேட்கறாங்க அப்படின்ட்டு. பட் how is the patient load for it? அது இன்னும் இருக்கா, இல்ல இந்த மாதிரி ஒரு வேற கண்ட்ரில ஒருத்தவங்க படிச்சு ரிட்டர்ன் வரும்போது அகைன் அவங்க ஜென்ரலா பிராக்டிஸ் பண்ண வேண்டியது இருக்கா? என்ன மாதிரி ஒரு மேட்ச் இருக்கு சார்?
ஓகே, ஸோ அது வந்து இட் டிபெண்ட்ஸ் ஆன். இப்போ நம்ம இந்தியால we don't have any dearth of patient load. ஸோ இப்போ எனக்கு தெரிஞ்சு எனிவே people who train abroad usually stay abroad. அப்படி இந்தியால வர்றவங்க என்ன பண்றாங்கன்னா, இந்தியால வர்றவங்க இப்போ நான் இந்தியா திருப்பி வந்தேன்னா, I don't want to practice adult radiology, I just want to practice pediatric radiology, and I would say there is a lot of scope. என் சொந்த ஊர் வந்து மதுரை பக்கத்துல. So I will say that there is a lot of scope. Why would I say that? Because what all can I do is, so இப்போ வந்து pediatric radiologyன்றது it is quite complex for an adult radiologist to interpret. அது வந்து என்னோட எக்ஸ்பீரியன்ஸ்ல நாங்க தமிழ்நாட்டில் ஒர்க் பண்ணும்போது என்னோட ரொம்ப சீனியர் people who have 20-30 years more experience than me, I have seen them struggle with that. So இப்போ அந்த மாதிரி இருக்கும்போது நம்மளுக்கு it is, see, as Lavanya directly said when told about radiology, it is a lot of responsibility. ஏன்னா whatever diagnosis you make, it is going to be the patient is going to face it. Say ஒரு இப்போ even see ஒரு CT chestல சும்மா ஒரு consolidation இருக்குன்னா, you just give it as infection, they'll treat with antibiotics. You call it TB, they'll start them on antituberculosis, ATT start பண்ணிடுவாங்க. அந்த மாதிரி இருக்கு. ஸோ அந்த மாதிரி இருக்கும்போது it is a lot of responsibility. So if say come, definitely there is a lot of caseload. There is a lot of, you either join say for example இப்போ onco imaging படிக்கிறவங்க, you go to onco hospitals and work. There are still options available. Or what you can do is, you can say for example இப்போ நான் மதுரையில போனேன்னா, I don't have a children's, there are some dedicated children's hospital, but அங்க அவ்வளவு கேஸ் லோடு வால்யூம் இல்லை அப்படின்னா, I can still work in 2-3 institutes. So for that, under region, so the tier 1 cities have already evolved into subspecialty imaging. Tier 1 cities, இப்போ சென்னையிலனா, it is almost everyone is neuro, the oncorad is way evolved. Interventional radiology ரொம்ப evolve ஆயிடுச்சு, pediatric radiology ரொம்ப evolve ஆயிடுச்சு, neuro radiology ரொம்ப evolve ஆயிடுச்சு. Because தமிழ்நாடு, Chennai is where a lot of subspecialty training is happening. For all over India, radiologists come to Chennai to get trained. Be it Dr. Sanchanaa சொன்ன மாதிரி breast imaging at Ramachandra, they have a fellowship. They've been running it for years for breast imaging, and it is one of the best places so one of the best places to get trained. So அந்த மாதிரி இருக்கும்போது, and tier 2 cities will follow. Maybe 5 years or 10 years from now, tier 2 cities it will follow. It will soon follow. They will also start. இப்போ மதுரையிலுமே already it has almost started. இப்போ people who are dedicatedly doing neuro imaging have already come in Madurai. So அந்த மாதிரி இருக்கும்போது இப்போ 2-3 ஹாஸ்பிட்டல்ஸ்ல ஒர்க் பண்ற மாதிரி இருக்கும். So that, but you will be the go-to person in that region. So இப்போ நாங்க மதுரையில ஒர்க் பண்ணும்போது, there was one neuroradiologist. So any doubt in எந்த ஹாஸ்பிட்டல்ல என்ன டவுட் இருந்தாலும் அவருக்கு போகும், because he was popularly known in that region. So அந்த மாதிரி இருக்கும். இல்ல, or you can go to these specialized hospitals where you can establish your practice. Or you can make it like an imaging firm. உங்க இப்போ second opinion மாதிரி there are options available. Second opinion, I know a senior who is doing that. அவர் என்ன பண்ணாருன்னா, ட்ரைனிங் ஆனாரு, he is working in a hospital. அந்த ஹாஸ்பிட்டல் அவ்வளவு கேஸ் லோட்ல, but he has an online portal where people from all over the world can submit cases to him. He reviews the cases and gives them a second opinion. This is all possible. So அந்த மாதிரி, but the way India is flourishing and the way Tamil Nadu is flourishing, I think we will soon get into the fetal imaging. Not எல்லா இடத்துலயுமே எல்லாருமே எல்லாம் antenatal பண்றது இல்ல, antenatal scan பண்றது இல்ல. It is still happening in maybe peripheries of Tamil Nadu, and all it is still happening. But especially level 2, நிறைய corporate hospitals எல்லாம் சும்மா with just radiology, they don't allow them to do antenatal imaging. they want them to have a fetal medicine fellowship or a fetal radiology fellowship. And even breast imaging, a lot of centers we have already, I think even in Ramachandra, not everyone does, no? So you will have to have a subspecialty to handle those patients. Appada nama report to reliable and the patient outcome also matters. Yeah. So we have already evolved into that phase, and we will tier 2 cities are soon following it.
Okay, great, sir. Thank you for putting it. Thank you. Yeah. So I will quickly move to Sanchanaa, ma'am.
Today, no specialty is an end specialty. No specialty. You do pediatrics. முன்னாடி எல்லாம் பீடியாட்ரிக்ஸ் வந்து அதை முடிச்சுட்டா அவ்வளவுதான் அப்படின்னு. Today, pediatric nephrology, pediatric hepatology, pediatric neurology, and you see pediatric radiology. I mean, of course, pediatric radiology is with the radiologist, but any specialty you take, ops எடுத்துட்டா they're doing reconstructive surgery தனியா பண்றாங்க, high risk ஆப்ஸ்லயே ஹை ரிஸ்க் ஆப்ஸ் தனியா பண்றாங்க, ரெகுலர் ஆப்ஸ் தனியா பண்றாங்க. யூ ஹேவ் யுவர் MS MCH அந்த பாத்வே இருக்கு. MD DM இருக்கு. ரேடியாலஜில we have a DM branch, interventional neuroradiology இருக்கு. At the moment, I think PGH Chandra is trying to introduce a DM for women's imaging also, that is coming in. So DMA வருது for these. So it's nowhere near. I don't think in pathology you have oncopathology, hematopathology, nephropathology, no end specialties anywhere. Whether you're gonna, and all of these fellowships, all of these subspecializations, you get into them through an entrance exam. So do not avoid medicine or surgery thinking I don't want to write NEET essays, because you'll come to radiology, pediatrics, ops, and then still write an entrance, a national entrance to get into a fellowship. You can take ortho, you name it. There is no end specialty today in any field. So forget that concept altogether. Subspecialization is the way to go, because I think today we realize that knowledge is abound. One person just cannot do everything. ஒருத்தரால எல்லாமே பண்ணி perfectா பண்ண முடியாது. It's only when we subspecialize, அதுலயே வந்து கவர் பண்றதுக்கு we are struggling. We have to know everything to keep up to date. AI வருது, neuro imaging and எடுத்துட்டா every day there's a new sequence, there's a new technology that they're applying to do. So அதனால you keep having so many new things. Subspecialization will be the rule. Radiology பொறுத்த வரைக்கும் consultants are looking for subspecialists to refer to. So adhanale that demand is good. They are driving that demand. They would, to be honest, one of my consultants, when I finished, they told me, அடுத்து என்ன பண்ண போறீங்க, FRCR, you're going to do a fellowship என்ன அப்படின்னு. I said, sir, ரெண்டுமே ஆப்ஷன் இருக்கு. டெஃபினட்டா breast fellowship I'm going to do. அது வரைக்கும் மேபி I'll keep writing FRCR சார், இன்னும் டிசைட் பண்ணல சார்னு. He said, UK போற மாதிரி இருந்தாதாமா FRCR, இல்லைன்னா இந்தியாவில் FRCR is not really adding much. It is because consultants are looking for a subspecialist. ஒரு கேஸ் அனுப்புறதுக்கு அவங்க கண்டிப்பா ரிலையபிளா நமக்கு ஒண்ணு கொடுத்துருவாங்களா அப்படிங்கறதான் கன்சல்டன்டோட பாயிண்ட் ஆஃப் வியூ. ஸோ இன் தட் வே, இஃப் யூ நாட் பிளானிங் டு கோ டு த UK or anywhere else, your focus should be on a subspecialization அப்படிங்கிறது எனக்கு ஒரு அசோசியேட் ப்ரொஃபஸர் கொடுத்த input at that point in time. So when you finish your PG, you have several options. Yes, one, you can get back into medical college where your learning is, or you get a lot of free hand as an SR in a medical college where you have your qualification, your procedures are directly under you, and you're on the learning path goes like that. Earning, yes, will be a little less compared to the private or the corporate and all of that, but the learning, that's where it really abounds. That is one thing. Ilena, of course, you can get into corporates. I think generally ask for some experience post PG before they even take you. They don't take you just like that. So on the corporate, you need some experience somewhere. Another option, of course, is scan centers, private scan centers, smaller scan centers where you can work. A lot of women, seniors and prefer that option, because by the time you finish your PG, you're 27, 28, sometimes 30. So you are also, to be honest, under you're also in the family way at that point. You're getting married, you're having children, you already have a toddler. So many girls who do PG are ridden with the guilt that they had a child during PG but never really got to spend time with that toddler because they were studying for the exam. So a lot of them tend to pick up a scan center where they work for 2 to 3 hours or 4 hours a day. So the rest of that time they can spend with their child. And also a lot of people who get married post PG. There are people who choose to have children post PG. So they find that in the scan centers you will have senior radiologists who are running the show, so you will be able to learn from them also. It may not be exactly like the medical colleges, but you will have learning. A very comfortable option for a lot of women who want to at that point take care of multiple things, and over 3 hours, 2 hours and all they go. The earning is according to that, based on your hours and things like that. The rest of the time you can balance, and then you can, as your child goes into play school or school, you can keep scaling up that the number of hours that you do. And of course there is a concept of remote reporting as well. I think Ebinesh, he touched upon it. That also a lot of people do exercise that option, where during that early postpartum period and when they're breastfeeding, they have the option of remaining in touch with the subject. They have the option of being under the guidance of senior radiologists, and still prioritizing family. I think that's a big deal in radiology. I know that there are so many women, not just me, who thought surgery OG, but last minute shifted into radiology with such aspirations. It happens, and it's radiology has a lot of options in that regard as well. You can scale up in time. And the next point is about AI. I think you said AI vandu. I've attended training courses in AI. What the trainers always said is AI will not replace radiology, but radiologists who use AI will replace radiologists who do not use AI. So you must incorporate it in your training. You must get into it. Even if you're a surgeon, if you're in medicine, if there is AI coming up, you better know it. It's already here. But yeah, it will never completely replace the person, the human doctor, because there is a component of emotional care, and every patient has a different doubt, a different situation, and there's no way AI can completely cover that. And so you will never be completely replaced. At least nowhere in our lifetime you're not going to be completely replaced. In your lifetime you're not going to be completely replaced. But AI will make your job easier. It will improve efficiency. It will, if you look at breast, UK how they're using it is, India, one person sees the image, mammogram, and then they do the ultrasound and then they report. India, we don't have this concept where we do the mammogram and send off the patient, and தேவைப்பட்ட ultrasound கூப்பிடுறதுலாம் இல்லை. Patient வந்துட்டாங்கன்னா எல்லாத்தையும் ஒட்டுமொத்தமா முடிச்சிட்டு தான் we send the patient home, so that they don't have to travel again. That's how Indian system அப்படிதான். யூகே யூஎஸ்லாம் எப்படின்னா பேஷண்ட் வந்து ஸ்கிரீனிங் மேமோகிராம் வந்து பண்ணிட்டு போயிடுறாங்க. தேவைப்பட்டா திருப்பி தே கால் ஃபார் அல்ட்ராசவுண்ட். ஸோ அப்படி இருக்கும்போது பேஷண்ட்டை திருப்பி கூப்பிடணுமா அப்படிங்கிறது ஒரு பெரிய கேள்வி ஆயிடுது அவங்களுக்கு. அண்ட் அப்படி இருக்கும்போது மோர் தேன் ஒன் ரேடியாலஜிஸ்ட் வில் ரீட் தட் இமேஜ். ரீடர் 1 இருப்பாங்க, ரீடர் 2 இருப்பாங்க. 2 பேருமே பேஷண்ட்டை திருப்பி கூப்பிடணும்னு நினைச்சாதான் தே கால். அந்த மாதிரி சிஸ்டம் எல்லாம் இருக்கு. ஸோ வாட் ஏஐ டஸ் இஸ் தட் it becomes a second reader and the madri pannu, where you will still need somebody to take the medical legal hit, because AI vandu oru thappu solliruchuna, then who is responsible? Is it the company that is owning the AI? Is it the hospital? Who is going to be responsible for the mistake that AI makes? You are the person there who is on the spot, who is deciding. You will not be replaced, and so you don't have to worry about that, but you do have to incorporate it in your training. You may have to go separately and get trained and come back. You can do that.
Thank you. Yeah, I will quickly move to Lavanya ma'am also. You need to get your opinion on the same.
Yeah, so right, I'm going to take maybe a little bit more time on this answer. I do know people have already given, but I think AI in radiology, let me just address the elephant in the room first, right? That's one the biggest question a lot of people have. And I wish I were as optimistic as Dr. Sanchanaa and I mean, like, it's fair. I don't like disagree with what they are saying, but at the same time, I have a different insight because I married an AI engineer. My husband works in AI tech company, and I'm right now sitting in Silicon Valley, where all the major investments into billion-dollar investments into Google, Nvidia, Microsoft, Amazon, FANG guys, they are all obsessed with health tech. They see radiology as the most profitable because I'll tell you why. You need high quality objective data. Number one, data is the new gold, right? உங்களுக்கு வந்து எந்த மெடிக்கல் ஃபீல்டுமே இந்த அளவு objective data with a ground truth comparison. You have pathology reports. நாங்க ரிப்போர்ட் கொடுக்கும் போது we are in the blind and we're giving reports. The AI models that they are training is, they know what is the right diagnosis, and then they're feeding that data, and then they're asking a set of radiologists to validate it and teach it. Remember, these radiologists are paid better. The tech companies pay radiologists better for validating than what an average hospital does, right? So it's right now what we are seeing. So now, and I also attended Stanford University. My house is like 20 minutes from there. So there's a AI medical imaging symposium that they run, where not just radiologists, pediatricians, dermatologists, cardiologists, ellaru okkandu, this is what they're talking about. This is where the money is. This is where the investment is being made. Country-wise, people are running. AI is the next industrial revolution. There is no doubt about it. In fact, at a country level, there is a competition of why is US behind, China, and why are there so much geopolitical struggles going around it? Because it is the next, clearly the country which harnesses AI owns the power for the next 100 years. That's how it is going to be, because this is the next technological revolution. In இப்ப நம்ம இருக்கிற AI so I'll give you from the technological perspective, we call it as generative AI or large language models. இப்ப இருக்கிற tech they're very good at doing a narrow scope of activity. அவர் சொன்னார்ல, nodule detection, triaging, ஒரு 10-100 lung CT பார்த்து இந்த nodule இருக்கு அப்படின்னு கரெக்டா பிக் பண்ணிரும். Some of it is even good enough to tell, even today it's good enough to tell that this is cancerous and not benign. And the level of diagnostic acumen it has already. But where it struggles is, ஒரு lung fibrosis இருக்கு, ஒரு வேற ஏதோ pathology இருக்குன்னா அதுக்கு ஒண்ணுமே சொல்ல தெரியாது. அது and plus it also hallucinates a lot. நீங்களே போய் ChatGPT, இப்ப ஏற்கனவே 90% of my time I'm spending on ChatGPT only, which I don't know is that a good thing or a bad thing, but if you've had any experience with ChatGPT, you will know it hallucinates a lot. நீங்க போய் ஒரு CV எழுத சொன்னா நீங்க அதுக்கு கான்டெக்ஸ்ட் கொடுக்கலனா ஒரு 10 புதுசா உங்களை பத்தி அதே எழுதி வைக்கும். அதெல்லாம் நான் சொல்லவே இல்லையே அப்படின்ட்டு you will ask. Same problem happens in radiology. So you can imagine if it goes around making stupid diagnosis or in the madi crazy edavadhu idu panna, patient is going to flabbergast you. Neenga medical legal idu romba problem aidum. But this is infant steps of AI. We are seeing the most primitive version of AI. Adhe radiologist ku 80% accuracy in specific narrow zones of task irukku. In future, what all the tech companies are working towards is bringing something called AGI, which is artificial general intelligence. So AGI they are predicting is going to be 20 years, it's going to be 30 years, it's going to be as like tech companies will make you believe that's going to be 5 years also, because they need to sell you the product. Adnala abdi solluvanga. But AGI vanduchunaka, what AGI is அது ஒரு human level autonomous function. Humans மாதிரி clinical decision making பண்ணுறது, humans மாதிரி logical context கொடுக்கறது. இப்போ நம்ம சொல்றோம்ல, I'm a clinical radiologist, நான் clinical information integrate பண்ணுவேன், histopathological information integrate பண்ணுவேன், clinical context எனக்கு புரியும், பேஷண்டோட பேசுவேன், எல்லாம் பண்ணி நான் ஒரு diagnosis கொடுக்குறேன் அப்படின்னு. இந்த வேலையை அதால பண்ண முடியும் 20 years down the line if an AGI comes, or that is what they're aiming at. If it comes, and all these people making billions of dollars of investment, they are not wrong. They're doing it because they see there is a scope to do it. Adanala dhaan adha pandranga. But அப்படி ஒரு சிச்சுவேஷன்ல if at all you assume, first of all, இது இந்த அளவுக்கு ட்ரூ வேர்ல்ட் இம்ப்ளிமெண்டேஷன் நடக்க ரொம்ப நாள் ஆகலாம். 2017 the godfather of AI சொல்வாங்க, Geoffrey Hinton. He came and told radiologist is like a coyote which has climbed over the cliff and has not looked down. நீங்க don't even train radiologist anymore அப்படின்னு ஒரு criticism கொடுத்தாரு. அதுக்கு கவுண்டர் பண்ற மாதிரி தான் கர்ட் லாங்லாட்ஸ்ங்கிறவர் வந்து ஹீஸ் ஸ்டான்ஃபோர்ட் ரேடியாலஜி ப்ரொஃபஸர் 2018ல he told AI radiologists who use AI will replace the radiologists who don't use AI. And 2019 radiology residency applications in US பார்த்தா it just skyrocketed because everyone believed that AI can't come in radiology. They were all saying, oh, AI la varadu, what will it do? It's just making so many mistakes. Thousands of years, I mean not thousands of years, but CAD irukku, MAMOல ஏற்கனவே automated detection இருக்கு, இது என்ன பண்ண போறது அப்படிங்கிற மாதிரி தான் பேசியிருந்தாங்க. But the way it has evolved in the last 7 years, I will not be surprised if something like an AGI or something at that level of automation happens within 20 years down the line, because right now the AI that we are seeing is very, very nascent. But யோசிச்சு பாருங்க, ChatGPT வந்ததுலேருந்து நீங்களே எவ்வளோ விஷயத்துக்கு அதை யூஸ் பண்றீங்க. கூகுளோட நான் இப்போ ஒரு ரெஸ்டாரண்ட் ரெக்கமெண்டேஷன் வேணும்னா நான் ChatGPT தான் இப்போ கேட்குறேன். I customize it to the level that I want. So அந்த இது வந்து I think people and the human touch அப்படின்னு நம்ம சொல்றோம். But okay, this is all in the scenario. 10-15 years வந்து disruption நடக்க chances இருக்கிறதுனால தான், especially in radiology, before other specialties, people are asking so much questions about it, and it's a valid thing to be worried about. What my approach to this is, be AI indemnified, okay, be AI proof. I'll tell you how. நீங்க வந்து first of all know how to leverage AI. You have to learn what are the limitations of AI. இதை யூஸ் பண்ணா என்ன எங்கெல்லாம் தப்பு நடக்கும், எப்படி நான் வந்து ஒரு வேலிடேட் பண்ண முடியும், இந்த ஒர்க் ஃப்ளோ எப்படி நான் ஆப்டிமைஸ் பண்ண முடியும். You are the only person who knows imaging. You are the only person who knows when an AI is going to make mistakes, and you are the only person capable enough for understanding the two things today. So next 10 years is going to be a golden age of productivity for radiologists, because our sonna madri in the specific narrow task like bone age estimations, nodule detection, this saves us a lot of time. This is great stuff. In the madri report வந்து large language models வந்து they're very good with language. அதனால நீங்க ஒரு 4 findings சொன்னீங்கன்னாக்கா அந்த ரிப்போர்ட் அவ்வளோ அழகா உங்களுக்கு டக்குன்னு ஜென்ரேட் பண்ணி கொடுத்துரும். It saves you a lot of time. நீங்க 1 hourல ரிப்போர்ட் பண்றது, நீங்க ஒரு டெலி பிராக்டிஸ் தான் பண்றீங்கன்னாக்கா 1 hourல நீங்க ரிப்போர்ட் பண்றது, you can say if you're reporting 15 cases, if you have automated report generation and you have prompt engineered it to the way you want to integrate findings, it can do it. You can report nearly 30 cases, right? So you're obviously better pay, better productivity, better இது உங்களுக்கு வந்து ஒரு golden period இருக்கு. In the 10 yearsல leverage it smartly, learn about AI applications, how to optimize that in your workflow, how to be a validator, how to understand where it is correct and where it is not correct, how to make it better at a local level that works for your hospital. இந்த மாதிரி பண்ணுங்க. And second thing, health tech opportunities are opening up like anything for radiologists. ஏன்னா வந்து நான் இது பர்சனலா பண்ணல, but I am seeing a lot of radiologists go into an AI validator role, clinical role, because we are at the forefront of innovation when it comes to AI, and this is going to happen in every specialty, not just radiology. So AGI அந்த ஒரு scenario நான் சொன்னது வந்துச்சுன்னாக்க the world is going to look like a very different place. ஏன்னா எல்லாரோட ஜாப்ஸுமே அது ரொம்ப நல்லா பண்ணும். இப்போ ரீசெண்டா ஜான் ஹாப்கின்ஸ்ல இருந்து there was a study that pig gallbladder cholecystectomy surgery from the without any human, it is able to do surgery from the entire surgery, human intervention இல்லாம அதால இன்னைக்கு இருக்கிற டெக்னாலஜியாலேயே முடியறது. ஸோ ஃபியூச்சர்ல கண்டிப்பா we cannot say that the technology will not be as good as radiologistங்கிற ஒரு difference இன்னைக்கு ரொம்ப இருக்கு. பட் அது வந்து because it grows exponentially, I think we will reach that situation in 15 to 20 years. And for somebody who plans for a lifelong career in medicine, this is very important, because this is possibly a disruption which is going to happen today. And even complete replacement இல்லைன்னாலும் நீங்க என்ன ஆகும்னாக்க, ஒரு 10 பேர் பண்ற 10 ரேடியாலஜிஸ்ட் பண்ற ஒரு விஷயத்த வந்து ஒரு AI plus one radiologist can do அப்படிங்கிற மாதிரி it may bring down the volume. So reimbursement may come down, because then they will question you, why do I need to pay so many radiologists if I can get the work done by using an AI plus one radiologist? You can be a validator, legally approve it and get done. பட் இந்த மாதிரி ஒரு இந்த லீகல் ரெஸ்பான்சிபிலிட்டி எடுத்துக்கிறதுக்கு நான் சொல்றேன், they will always have a radiologist in the loop, but they'll just hire one person instead of 10 and be like நீ வந்து இத பண்ணிக்கோ அப்படிங்கிற மாதிரி. And not all countries do ethical practice. Corporate hospitals எல்லாம் வந்து ப்ராஃபிட் மேக்ஸிமைஸ் பண்ண முடியும்ட்டு அவங்களுக்கு தோணுச்சுன்னா அதை தான் பண்ணுவாங்க. அவங்க வந்து ரொம்ப they should be much more ethical than that, but if they find reasons to justify a labor cut down, they can very well do it. So in the situations the next thing that you should do is subspecialization. நீங்க வந்து உங்க ஃபீல்ட்ல you have to be very good with what you do. ஒரு நியூரோ எடுத்துக்கோங்க, இல்ல பீடியாட்ரிக்ஸ் எடுத்துக்கோங்க, இல்ல இந்த மாதிரி ஏதாவது ஒரு சப்ஸ்பெஷலைசேஷன் நீங்க பண்ணீங்கன்னாக்க அதெல்லாம் வந்து ஏஆல அவ்வளோ குவிக்கா ரிப்ளேஸ் பண்ண முடியாது. பிகாஸ் a very hard questions that you're solving. ஒரு இது வந்து பிரெயின் டியூமர் வந்து திரும்ப வந்துருச்சா வரலையா இந்த மாதிரி கேள்விலாம் உங்கள்கிட்ட கேட்பாங்க. இதுக்கெல்லாம் வந்து ஒரு ஹை லெவல் ஆஃப் சப்ஸ்பெஷலைஸ்ட் எக்ஸ்பீரியன்ஸ் இருந்தாக்கா தான் அவங்கவுங்க ஃபீல்ட்ல வந்து நீங்க டெடிகேட்டடா பண்ணீங்க அப்படின்னாக்க உங்களுக்கு வந்து you will be irreplaceable, because no AI can replace you in those kind of challenging situations. And yes, you are answering very difficult questions ங்கறனால உங்களுக்கு மார்க்கெட்லயுமே you will have a high demand for it and you will be paid well appropriately with it. எல்லாமே இருக்கும். So அந்த ஒரு if you have to focus on being better, you have to focus on learning the new tech and adopting it, but the next 10 to 15 years also is a period of golden productivity for radiologists, where we can have better income, better earnings, all of this if we are leveraging AI. And after that, to stay relevant, you should do these things. Abingiradha vandu my opinion about this.
Great. That is a very in-depth thing. So I think like in the video I think I have to surface to other radiologists also, so to get the what is the future and opportunities in radiology. So thank you for that in-depth analysis, ma'am. So I think we have touched down on everything, and so I think we can come to the final session. So final one question. So one question is யாருக்கு radiology suit ஆகும், யாருக்கு radiology suit ஆகாது? And second thing, what is your final advice for people who are dreaming of radiology? And I missed one question in between. Is radiology is only about sitting in a dark room and looking at scans? அப்படின்னு சொல்லிட்டு ஒரு thought இருக்கு. So அதையும் maybe address பண்ணிட்டு you just give your last set of advice, and யாருக்கு இது சூட் ஆகும் ஆகாதுன்னு மட்டும் let us brief it and we will close it. Yes sir, I will start with Ebinesh sir.
Okay, thank you again. யாருக்கு செட் ஆகும் யாருக்கு செட் ஆகாதுன்னா, this is for people, so this is basically for people who will love to know more. That is my understanding of it. Who will want to எனக்கு இன்னும் நிறைய கத்துக்கணும், இன்னும் எனக்கு knowledge accumulate பண்றது. People there, I know people who are crazy about accumulating knowledge. And கொஞ்சம் பேருக்கு வந்து this also gives them an opportunity where you can also try your hands on. It's like you can so for some people it's not just about skills, they also want to know and they also want to have the skills. If I say for example my work schedule, என்னோட work schedule எப்படி இருக்குன்னா, I work 5 days a week. One day வந்து it is about interventions. So one day we do all the interventions. So you will also do things with your hand. At the same time you will நீங்க கத்துக்கிறதுக்கு நிறைய இருக்கும். So it is for someone who wants to know more, நிறைய தெரிஞ்சுக்கணும்னு இருக்கு அவங்களுக்கு. இன்னொன்னு, it is also for people who, to be honest, it is also for people who want a good work life balance, who think that okay, I'll need இப்ப இது எனக்கு எப்பவுமே படிச்சுட்டே இருக்கணும் இல்ல, எனக்கு படிக்கிற டைம்ல படிப்பேன், வேலை பார்க்குற டைம்ல வேலை பார்ப்பேன், ஆனா எனக்குன்னு என்னோட கொஞ்சம் டைம் வேணும், என்னோட ஃபேமிலி கூட கொஞ்சம் டைம் வேணும், எனக்குன்னு ஒரு பர்சனல் டைம் வேணும் அப்படின்னு இருக்கிறவங்களுக்கு definitely radiology is the best option. And the one more is radiology it also gives you, it also helps you evolve with the field. Radiology, to be honest, is one of the rapidly evolving fields in the field of medicine. So you'll also get an opportunity to evolve with the field. So it is fit for everyone. So யாருக்கு இது சூட் ஆகாது அப்படின்னு பார்த்தோம்னா, இப்போ and it is also about it also involves நீங்க சொல்ற மாதிரி இருட்டறையில இருந்துட்டு ரிப்போர்ட் இருட்டு ரூம்ல உட்காந்துட்டு ரிப்போர்ட் பண்றது. So some people are very very restless. It's like they want to, they know that they can't be still, they can't be patient, sit in a place, patient ஒரு பேஷண்டா ஒரு ஸ்கேனர் ஸ்க்ரோல் பண்ணி பார்த்து ஒன்னொன்னா பார்த்து ரிப்போர்ட் பண்ண முடியாது. அந்த பேஷண்ட்ஸ் இல்லைன்னு இருக்கிறவங்க they'll just want to meddle with their hands, meddle things with their hands. So அப்படி இருக்கிறவங்களுக்கு it might not be suitable, and people might and so அந்த மாதிரி இருக்கிறவங்களுக்கு suitable ஆகாது. It will be for people who who love med. And one more is it will be the best field. And there is a taboo that radiology is not a clinical field. That is, radiology is, I feel radiology is one of the most clinical subjects that you can ever have, because on the level of clinical knowledge you need as a good radiologist. Yeah, to be a good radiologist, the level of clinical knowledge only clinical knowledge, and it is at par with any other clinician. So you'll need a very good clinical knowledge, right? So it is not that radiology is not a clinical subject. But if someone thinks that someone gets overwhelmed about learning things new or being up to date, அந்த மாதிரி இருக்கிறவங்களுக்கு radiology might not be the field அப்படின்றது இன்னொன்னு. And one more is yeah, during your அதாவது வந்து உங்களுக்கு இன்னொன்னு வந்து when you are choosing a subject, I would say that I would say that you will have to talk to people about. I know people who got into radiology also who did not like radiology and left radiology. But I know large majority of people who did not take radiology but then ended up into radiology, who took something else and then ended up into radiology. That is a majority that I know of. But there is a minority or a handful of people who have left radiology and gone to be with others. So எந்த மாதிரி இது உங்களுக்கு இருக்காதுன்னு எக்ஸ்பெக்ட் பண்ணீங்கன்னா you won't feel that. Some people think that you won't have that satisfaction. ஒரு பேஷண்ட்டை நம்ம ட்ரீட் பண்றோம், ஸோ பேஷண்ட் குடும்பமா வந்து நம்மளுக்கு தேங்க்ஸ் சொல்றாங்க அப்படின்லாம் இருக்காது. It will be a field of very few thank yous. It will be a field of very few thank yous. You will have to accept it. But then you have the joy of you really have the joy of solving things for the clinicians. So you might not be you will be the hero behind the screen, but still you won't be the hero. Someone else will be taking the credit for you. And so that I am happy with. I want the clinical problem solving skill that I want to solve a question for and that is what in the radiology one thing that's coming up is we all have MDTs and சொல்லுவாங்க, multidisciplinary team discussions. So it routinely happens in the UK, and even when I was in India it was happening in most of the hospitals I know. So radiologists sit with the clinicians and they all discuss about each patient. So they all discuss about each patient and come into and bring out a solution. So அந்த மாதிரி இருக்கும்போது it is you are a part of a team, but you won't be getting that credit. That is to be really honest. So but still it is like you will be known among your I have had people who were like, okay, thank you so much, I was struggling so much with that patient, thank you for your input, because that helped us solve the issue. And that was, so you will be known for your colleague, known among your colleagues, but you might not be known to a patient. No one knows, no one யாருக்குமே இப்ப யார்கிட்ட கேட்டாலுமே I don't know if I got when நான் சின்ன வயசுல இருக்கும்போது எனக்கு ஸ்கேன் பண்ண பேரே தெரியாது எனக்கு. I know the people who I know if எனக்கு when I had to I mean when I had a bad sinusitis, I know the doctor who treated me for sinusitis, but I really don't know the person who reported my NCCT PNS for me. So yeah, that is true. That is a fact. It is not a field with a lot of thank yous, but then it is definitely professionally satisfying. It is definitely professionally satisfying. It is not that I really love radiology. I have literally fallen in love with radiology. That is for sure. So I always say that after God and my wife, it is radiology for me. So it is like that. You will have a very good professional satisfaction with radiology. At the same time, you can explore so much more in life also. Right? It is not just about hustling. You can do much more in life, and radiology gives you an option for that. And with teleradiology and everything that is booming, and you can report for anywhere in the world. So on the options, why not explore it? No? Why not explore it? Why not utilize it to make your life better? Right? Eventually, that is all what we need. And one more thing that I wanted to add after PG was, after PG பண்றவங்க, what I would usually advise is, if you're doing your PG in a government hospital, in a government college, I would say go to a corporate hospital, have some experience there. Because that is where, so to be really honest, the bitter truth is, in India, more than academia, things evolve, or technology evolves more in corporate, right? Technology evolves more in corporates. Corporates are embracing more of technology than the academic institutes, to be really honest. Yeah. So if you are if you do your PG from a government medical college, go to a corporate, get some corporate experience. If you do a DNB in a good corporate hospital, corporate hospitals to a lesser to certain extent lack the spectrum of cases. So I would say go to a government hospital, do an SR shift. Go to a government hospital or a good teaching medical college hospital and get some experience there. That would be my advice after PG. Right? So as such, I would say radiology is very professionally satisfying, and I love it. And I hope everyone will love it, because radiology, it is something where it is not that it is, and it is again a taboo that it's only for introverts. I am an extrovert myself. And it is not that you just sit in a dark room and you talk to a lot of people. Depending radiology, maybe you're not talking to patients, but one beautiful thing about radiology is you'll have to switch gears so rapidly. அதை நான் பிஜி பண்ணும்போது தான் ரியலைஸ் பண்ணேன். திடீர்னு எங்களுக்கு என்ன வரும்னா, வேற ஹீமோஃபிலியா சென்டர் அல்ட்ராசவுண்ட் நீட் டு லுக் ஃபார் ஹீமார்த்ரோசிஸ் வரும். அடுத்த பேஷண்ட் ஆப்ஸ்ட்ரெட்ரிக்ஸ் பேஷண்டா இருக்கும், will be PV bleeding or there will be a placental abruption. அடுத்த பேஷண்ட் there will be a pediatric patient with intercession. அடுத்தது ஒரு அடுத்தது there will be a liver abscess. அடுத்தது there will be a chest for pleural effusion or empyema. அந்த மாதிரி இருக்கும். You'll have to rapidly switch gears, so your brain also works according to it. So if you think that it is not, you are more of a doing person than a thinking person, then probably you will have to think. But still, if you do radiology, there is an option of interventional radiology that is still there. So yeah, radiology is something that will happen to you if you are up for radiology. Yeah, that is what I feel. And once radiology happens to you, there is no way you'll turn back.
Thank you so much, sir. So you believe me, like நீங்க இப்போ ஒரு group of people radiology எடுக்கலாமா வேணாமான்னு நினைச்சிட்டு இருந்தாங்களா, நீங்க கன்வெர்ட் பண்ணிட்டீங்க to radiology definitely at this thing. And the specialty of less, thank you. So that is something, maybe a tagline for radiology itself, we should keep it. So that is also hitting hard. And we wish your love story continues with radiology. So because from the starting itself, you are fascinating, and ஒரு fascination இருந்துட்டே இருக்கு. That is really that is how much you love the thing you do. So thank you so much for putting it this way. And people will definitely believe me that you have converted so much people who had a confusion. So should I take a radiology or not? You have converted that. Thank you for that line, sir. And yes, to Sanchanaa ma'am.
எனக்கு தெரிஞ்சு there are two groups of people who take radiology. One is Ebinesh sir மாதிரி. That is, they say I am fascinated with puzzle solving. That said, அவங்க வந்து மெடிசனும் எடுப்பாங்க, ரேடியாலஜியும் எடுப்பாங்க, because both fields are somewhat into that kind of work. And there is another huge group of people who decide அது வேண்டாம் அதனால radiology பண்ணுவாங்க. And there is another group that takes it for the extra radiological benefits. So whatever the reason be, you have to be clear about why you're taking it. And radiology, but at least this particular thing came from a guy. Maybe if you feel that you want that the limelight of the surgery medicine only, that you should really think, don't take it because it is the number one specialty in the rank list. Abdina solli edukka vendam, because I do know that there is a person in my own batch who regretted that particular decision. And not that they didn't discontinue, they're doing very well. When I was on night duty with that person, I know that very reliable to report with. Adnala enak endha doubtum illa. But yeah, manasukulla and the regret vandrumo bayam irundha, don't take it because you got rank 1, because you got rank 100. Adukkaga edukka vendam. But all the other reasons, including work-life balance, including being fascinated by the whole puzzle solving thing, and all of those reasons are pretty valid. And I've known many people who have taken it for the work-life balance. They remind themselves that they took it for that reason. They're happy about it also. That is one thing. The only person who shouldn't take it is the person who wanted something else, but rank வந்ததுக்கு அப்புறம் everybody saying you radiology எடுக்க மாட்டியா, rank வாங்கிட்டு அப்படின்னு சொல்லி அதனால கன்வெர்ட் ஆயிட வேண்டாம். If you always felt that radiology was not for you, even after you get rank 1, go ahead and take that a general surgery or that general medicine seat in the top college. You'll get it. Obviously, you're the first pick. So that is one thing. The second thing is the dark room and no clinics. Now, breast has evolved. I'm in breast imaging and intervention. We do a lot. I'd like to elaborate a bit on this. Now, interventional radiology, DM edutha, you are on par with the surgeon. Lifestyle worse than neurosurgery, or on par with neurosurgery. They are running through the night, through the day. You're just dealing with stroke and bleed all the time, another brain bleeds, so you are there all the time. You are the person counseling the patient. You are the person doing the procedure from start to finish. It's you. Patients are very grateful. So in case you end up taking radiology, remember that IR is always an option if you think that you want to be in the thick of action. you have IR as an option. It's not that it's taken away from you. So for those of you who say IR is like 24/7, if there were 25 hours, aதையும் அந்த extra இல்லாத ஒரு அவளையும் எடுத்து கொடுக்கிற ஒரு field. So if you don't want that, being in breast imaging, today breast imaging and intervention is evolving to a point where I know corporate hospitals where when the patient walks in with a breast complaint, they come to the radiologist first. Because once a surgeon sees, அவங்களும் வந்து to know whether the mass or கட்டி வந்து cancer கட்டியா இல்லையா, benign அப்படின்னு தெரிஞ்சுக்கிறதுக்கு they need to do imaging. So there are corporates where the system itself has changed such that the patient comes to the radiologist first. You are the one seeing the patient, deciding what investigation to do and doing the investigation. And then if it's malignant, there are institutes where they send it to the surgical oncologist. And if it is benign, they send it to a general surgeon. And in certain cases of benign breast masses, we have something called vacuum-assisted excision of breast masses today, where the radiologist does the excision of a benign breast mass. So when you're doing any of this, you are dealing with the patient top to bottom. You are talking to the patient, you're telling them it's benign, you're doing the excision for them, you're finishing up everything. When you need to do alternate investigations, contrast mammo and others, you are talking to the patient. Not everywhere, but there are many corporates where radiology is the first, the breast radiologist is the first person who sees the breast complaint, even before the surgeon and the surgical oncologist see it. So do not think that you will not be the person on the front line. There are radiological subspecialties and super specialties where you will be the front liner. Okay, so we do have those. Apart from that, there's also fetal medicine where you do a lot of this chorionic villus sampling, a lot of these procedure பண்ணும்போது you don't just patient கிட்ட பேசாம you can't do any procedure, you will be counseling them. ஒரு fetus குள்ள போய் when you're trying to stick in a needle into the amniotic fluid, there's so much of counseling, so much of talking, so much of convincing, so much of allaying fear and anxiety that you'll be doing. There are radiological subspecialties today where you are on the front line, and there is always MSK injections, intra-articular injections where the radiologists repeatedly deliver injections to relieve pain. So you have it. There is a good 50 or maybe even 70% of radiology where you are behind the scenes, but there is a good 30% of radiology where you are on the front line. You have a lot of interventions starting from biopsies, aspirations, drainages, complex chest, CT guided biopsies, MR guided biopsies. It's grown leaps and bounds where you are there, you are on the front line. So you needn't think it's not entirely a dark room. A good portion of radiology is not entirely a dark room. And one more thing about the subspecialization is there are corporates that do expect you to have more than one subspecialization also. Sometimes they expect you to have 2 verticals. Verticals is under subspecialization. So they want you to be into women's imaging and neuroimaging. You need not do chest, pediatric, MSK, musculoskeletal ella panna thevilla. But they want you to have 2. They're not letting you have entirely one. They want you to have 2 because I think avangaloda logistics on the one person leave edutanga and over naadukkaga they can't employ somebody new, so they want somebody else in the department who can also take care of that for that one day. So it allows them to rotate the radiologist. So you may not be allowed to do just one, you may have to do 2, but a lot of radiology fellowships are 6 months, 1 year. You can always just do another fellowship quickly, and you are in the front line in many cases, so don't worry about that. You will be there.
Sure. Thank you, ma'am. Thank you so much for that. And I will move to Lavanya.
I kind of agree with everything that they've told, and they've articulated it beautifully, both of them. So I would like to say that radiology is for everyone. The one beautiful thing about radiology is நீங்க இதுக்குள்ள எப்படி வேணாலும் இவால்வ் ஆகலாம், மவுல்ட் ஆகலாம். இந்த ஃபிளெக்சிபிலிட்டி உங்களுக்கு வேற எந்த பிரான்ச்லயுமே கிடையாது எனக்கு தெரிஞ்ச வர. ஏன்னா to come in to even in like the AGI, there are like a lot of people who are not taking radiology because they're worried about AI. So I gave you the realistic picture of what could happen in the very drastic situation that the tech evolves a lot and it's on par with like every other professional to speak of. But even in that, நீங்க வந்து எவ்வளவோ விஷயங்கள் பண்ணலாம், right? There are a lot of things you can do where the tech is not going to come. நீங்க interventionsல நீங்க easily switch over பண்ணலாம். உங்களுக்கு in-depth imaging knowledge இருந்தாதான் image guide intervention பண்ண தெரியும். It's not like any other person can come and do it. ஒரு breast interventions பண்றாங்கன்னா breast radiologyல நல்லா train ஆகி அதோட imaging புரியறவங்க தான் பண்ணுவாங்க. Pediatric radiologyல fluoroscopy these are all in some sense interventions only. நீங்க pediatric radiology எல்லாம் யோசிச்சு பாருங்க, ஆட்டோமேட்லாம் சத்தியமா பண்ண முடியாது. ஏன்னா baby will be crying and you can't have a tech speak to it and be like, oh come cooperate for this doing this scan அப்படிங்கறதெல்லாம் வந்து you can't do it. And same thing with neuro intervention is, I would say, one of the most rewarding fields that's available today in the entire medicine. Stroke thrombectomy has changed the landscape. Minadi ஒரு காலத்துல ஸ்ட்ரோக்கு ட்ரீட்மெண்ட் கிடையாதுன்னு இருந்தது. இன்னைக்கு நீங்க ஒரு குட் ஸ்ட்ரோக் சென்டர் போனீங்கன்னாக்கா, if they have an interventional neuroradiologist on call, the outcomes are fantastic. If you do it within the window period and you do it, who's doing all this? This is a radiologist. So இது ஒரு நீங்க யாரா வேணாலும் ஆகலாம். நீங்க you are like, I want work life balance, எனக்கு வீட்டுக்கு போகணும், I want to be with my kids and have a relaxed stress free life. You can absolutely do it doing diagnostic radiology. நீங்க practice பண்ணலாம். breast மாதிரி fieldsல emergencies அவ்வளோ இருக்காது. So you can do a nice mix of elective breast imaging with interventions also. And you want to be action packed, you want to do interventions, you want to get that glory and fame. அந்த மாதிரி நீங்க இருந்தீங்க, that's you seek external validation a lot. If you are that kind of person, you can go ahead and market yourself as an interventional neuroradiologist, get referrals from everyone, give talks, give speeches, இதெல்லாம் பண்ண முடியும். Or even more laterally, எனக்கு மெடிசனே பிடிக்கல, எனக்கு I'm like tired of medicine, நான் வேற ஏதாவது டிஃப்ரெண்டா ட்ரை பண்ணணும்னா, the most tech heavy field is radiology. நீங்க ரொம்ப ஈஸியா you can pivot into health tech, AI startups, pharma companies. எல்லாரும் pharma companies, why they want you is இந்த மாதிரி post-op onco imaging லாம் somebody has to read it and tell you like what is the response status to it, whether the drug has worked or not. இந்த மாதிரி drug trialsல நீங்க involve ஆகலாம். எவ்வளவோ விஷயங்கள் நீங்க பண்ணலாம் if you are in radiology. So நீங்க it's not like a dead end that you choose it. Your life is just beginning. So நீங்க you can branch out into any field that you want. And the best part is various phases of lifeல நீங்க வேற விதமா எடுத்துக்கலாம். இப்ப என்னைய பொறுத்தவரை there are phases in life where I'm very motivated, I want to study, I want to be very intense, எனக்கு the top to toe எல்லாமே தெரியணும், அவ்வளோ drive இருக்கு. I'm in late 20s and early 30s அந்த மாதிரி உங்களுக்கு இருக்கும், right? அப்ப நீங்க இதெல்லாம் பண்ணலாம், நல்லா கத்துக்கலாம், பயங்கர in-depth போலாம். Then there's a phase where you want to spend time with your family, you want to cut down on practice, have like more good work-life balance. நான் like I am taking a career break. I can very easily do tele-reporting for a lot of hospitals. எந்த ஃபீல்ட்ல உங்களுக்கு இங்க மத்த ஃபீல்ட்லாம் நீங்க practice build பண்ணிட்டீங்கன்னா விட்டுட்டுலாம் போக முடியாது. உங்க ரெஃபரல் எல்லாம் போயிடும். You can't be out of the city. This branch gives you global mobility. You can go to US, you can go to UK, you can go, and everywhere there is a significant shortage of radiologists right now. US lala they are opening and calling radiologists. US is a country which doesn't allow any medical specialty to enter easily. Ipa anga kuda avlo bayangara demand irukku. For Indians it's a bit hard because of green card issues and a lot of things like that, which is why it may not be the best destination if you look at other factors. But if immigration is your goal, radiology is one branch which gives you awesome flexibility to go anywhere. UAE ahato, Singapore ahato. If you have an FRCR, you can work in other hospitals and get credentialing and get opportunities like that. So global mobility is great. Even within India, it's great. And so back to my point, if I want to have work-life balance, I'm having a kid in the madri situation, na tele பண்ணிட்டு அவங்க சொன்ன மாதிரி ஒரு private practice எடுத்துட்டு scan centers போயிட்டு peaceful-ஆ இருக்கலாம் அந்த மாதிரி stages of life-ல, and you'll still be remember making good money doing it. மத்த இதுலலாம் நீங்க break எடுக்கலாம், எல்லாம் எடுக்கலாம், but you will not have earnings. And for a lot of people, having decent earnings every day on a day-to-day basis is so important. So this field you can do it, being remote, being in the madri things la neenga pannalam. And again, there's a phase நீங்க வந்து திரும்ப கத்துக்கணும்னு நினைக்கிறீங்க, நல்லா இன்டென்ஸா பண்ணணும், branch out பண்ணணும், எனக்கு டிஃப்ரெண்டா லைஃப்ல ட்ரை பண்ணணும்னாக்க you can go into intervention, or you can keep your life as hectic as you want, have as much patient interaction as you want. Customization is very real in radiology. நீங்க எப்படி வேணுமோ நீங்க practice பண்ணலாம். அது வந்து it's a very big plus in radiology. The negative I would say is நீங்க அதான் உங்க diagnostic purely diagnostic radiology பண்றீங்கன்னாலும் it's a very difficult field. It's not like வந்து people underestimate the level of work and knowledge and value that a diagnostic radiologist is adding. I'm not talking about intervention guys. Intervention guys get acknowledgement for what they do, but nobody acknowledges or thanks the radiologist who made the diagnosis in the first place. So there are a lot of good clinicians who would call up and tell you that thank you, you really like guided me with this in the madri ungalku, you will get thank yous from them. There may be people who are not very graceful about it, and patients as a field radiology irukungirudhu they don't know. Unfortunately, they don't know that there's someone sitting behind. For all you know, there are many people who think that the machine itself is giving report, and they have reached that level of AI already. Adnala vandu so ipdila vandu fields irukumbodhu, so if you are somebody who needs a lot of acknowledgement and external validation, if that is something very important to you, then in that situation you will be forced to do interventions and go into a branch like that, and you can do it, you can still get it, but neenga andha madri targeted ah neenga evolve aganum. Yeah, that's the downside.
Thank you so much. So adan like the video started for NEET PG preparation. So nijamale the entire thing is like அங்க இருந்து ஸ்டார்ட் பண்ணி இங்க வரைக்கும் கம்ப்ளீட் எவல்யூஷன் பேசியாச்சு. Definitely I will promote this for radiologists also. So who are already radiologists, they also must see it, and I will definitely promote this video. So finally, for the people who are watching it, so this for especially for NEET aspirants like who are having a dream of radiologist. So this is all the experiences and opinions like the specialists have on their own specialty. So there is nothing to influence or nothing to make you do something. So this is all about the experience and the opinions. Idhula irundhu definitely you would have got like nijamale neenga radiology edukonu nenichina, I think in the 1.5 hours mela, I think you don't need anything, and you don't want to speak to anybody to understand what it is and how it is going to be. So I'm happy that today we have given a very good video and very good insight about radiology.